Thank you very much, sir. It's been an honor and a privilege to be with all of you today. Uh, for those of you who may not recollect who Elsevier is or what Elsevier is, we are the world's largest healthcare publisher, have been around in the current form for over 130 years and in various different forms for actually 400 years since Galileo published his Principia Mathematica with us, Principia Discorsa with us, when he said the earth goes around the sun, not the other way around. And then he was imprisoned after he published in our journal at that point in time. Um, Within the field of medical and health sciences, we publish a large number of the world's leading journals. The discovery of various different path-breaking inventions and discoveries in the field of medicine like penicillin, like even Viagra, were all published first in our journals and then eventually attained worldwide success. So we see ourselves and our role as publishing evidence-based scientific literature with the who's who of the world. Most of the Nobel laureates every year in the world are either editors of some of our journals or have published with us. So last year we had 9 out of the 10. The previous few years we've had about all 10 or 11 of the people who won Nobel Prizes in the field of medicine. What we see very interestingly is that while a large part of our global content sells very well in India, and specifically in the context of today's discussion, a number of our journals like Radiology Clinics of North America, Academic Radiology, all sell very well. A large number of the books on radiology, and what it says is there's a large demand of equipment around radiology in the country because that's why there are more books around it. So Dr. Carol Rumack's book on ultrasound, diagnostic ultrasound, sells possibly 30% of the world's sales in the country today. So on one hand, it means the equipment suppliers are doing a very good job. On the other hand, we're getting nothing back. So we as a publisher are not getting enough Indian data back. We are not seeing the results of what is happening. Is healthcare delivery actually improving? Is it actually bringing down costs? Is it increasing longevity? Is it improving quality of life? We're not seeing that. To put in context, today, China is actually contributing much more and has already become the world's second largest source of research articles after the US. India is not there. While it's increasingly, Indian authors are writing for our global journals, but it's still very, very small compared to what is happening in China. So if one actually thinks about it, and you go back to World War or pre-World War I, World War II levels, the world's leading research in medical was done in Germany. Because Germany lost the war, all the research was taken over by the US. And that's when the US came into the lead. We are an Anglo-Dutch publisher, and we were in sort of neutral ground in Europe around the time this happened, which is why a large part of the content still exists with us. But in 20 years or 30 years, the research leadership is going to be taken over by China. Are we as a country only going to be focused on commercialization, getting better infrastructure, but perhaps no real improvement in the lives of people? And it's a thought we all should think about, because until we actually start analyzing the results of what is happening, we'll not be as a society able to progress further. Research is a function of how we think as a society, how we are academically and intellectually honest, not subservient to the market forces of commercialization, which is what the world eventually succumbs to. We have put a lot of our content online. You can go back and search online on content, on articles that go back to the first issue of the Lancet, as an example. For those institutions that have access to our resources like AIMS, this is all available to you. You have to just search and say, has the research been done around this, and you can find the articles online. But as a society, it's very important that we progress on this. And from our perspective at Elsevier, we are establishing a very strong and robust publishing program for the Indian market. We are publishing a lot of textbooks. We have a number of authors around the country today. We have about 600 books we publish. Some of them we call the Elsevier Clinical Advisory Board in various specialities. We are now taking that content, going to be putting it online in context of our global knowledge base. So people around the world should be able to search for it. Otherwise, if it's just a paper book, nobody else can actually find out what's there. So we are seeing that India has the potential. But as a society and as people associated with the health profession, and we see ourselves as associated with at least the knowledge part of it and disseminating that knowledge and preserving that knowledge, we want to see how we can, as a country, progress. Because it's very important for all of us. And I think once we do that, we have enough data in this country to transform that into knowledge and into something that will actually improve the lives of people. So that's all I had to say today. Thank you.